Hi everyone, so my name is Gabrielle Sanborn and I'm presenting rat lung disease. I know that one of the other classmates of mine had done this and I was like, oh my god, that's such a genius idea. So here we are. So the kingdom for this is Animalia, phylum is Nematoda, class is Caesarnenta, genus is Angiostronglius, and species is Angiostronglius cantonensis. And this is a eukaryote. It's basically a parasitic worm. And I apologize if I butcher these words, but some characteristics of these parasites are the females are actually larger than males, coming in at 21 to 25 millimeters, where the males are 16 to 19 millimeters in length. These parasites have a tough outer cuticle and their bodies are unsegmented. So their life cycle. The adult worms live in the rat's pulmonary arteries, and then the females will lay their eggs, and then they'll begin their life cycle inside the pharynx of the rat, when they are swallowed and pass through the rat. And then after that, they end up going to the other host. So egg will hatch in the rat in the ileum, and then it will make its way up into the pharynx, and then get re-swallowed by the rat, and then that's how it gets passed through the rodent's poop. And at this point, this is a first stage larvae, and then the first stage larvae will be in the feces and it will be ingested by snails and slugs, who will then become the intermediate host. And then when they're in the snail and slugs, they will molt inside, and then after about 2 molts, this becomes the third stage larvae. And then the humans become infected by the third stage larvae. So humans, we contract this via ingestion, and this will affect our central nervous system. We are the accidental hosts. See, we don't transmit the infection, and they can't reproduce in us. So obviously, they wouldn't want to be anywhere near us. They prefer the rats. So if you see down there, I have a little picture, that shows the rats and the slugs, contain the infected parasite, and we get exposed usually through vegetation. Some risk factors that we have, is ingesting undercooked or raw snails, slugs, freshwater crab, and shrimp, or the infected parts of a snail or slug may accidentally get chopped up in vegetables and salads and juices, or vegetable product that we consume, and then we end up consuming this on accident. Also, a big thing is maybe not thoroughly washing your hands during the preparation of infected food. So, washing your hands before and after you handle produce of any type, just to be sure. So other animals, besides the rats and stuff, I know some frogs or other planarians of the genus Polydamas, can become transport hosts, and they're not required for reproduction, and they might be able to transmit the infection if eaten raw or undercooked, but there's not a lot of leads on that. There's only been a select few cases, but rats are most definitely the definitive host. They have them in their pulmonary arteries for reproduction and all that other stuff. It's mostly just the rats. And then for the environment wise, obviously the vegetation, that come in contact with the infected slugs and stuff. And then, there's open water sources that the rats and the slugs and everything can be in. And once they touch that, it's instantly contaminated, and somebody might drink or touch the water and not knowing that it's infected, and then not wash their hands, and then they end up ingesting it that way. So some symptoms and signs for the disease itself. So it will show about 1 to 3 weeks post-infection. It can be as early as 1 day to maybe even up to a 6-week delay. It really varies. And then the person will experience severe abdominal pain, nausea and vomiting, weakness, fever, and severe headaches and stiffness in the neck. And if this is very severe, or they ended up accidentally consuming a large amount of the parasites, they can also experience muscle atrophy, mild cognitive impairment and slowed reactions, respiratory failure, and lack of reflexes. And if it's left untreated, it can cause death or a rare type of meningitis. This type of meningitis can be tested by testing your cerebral spinal fluid, And if that's the case, that means that it's going, in through your brain, all that other stuff. So the sad thing for that is there is no treatment options. Since it doesn't reproduce in us, they will eventually die off, but they do cause inflammation. So the only thing that you really can do for someone who has that is to give them, support medications that can alleviate the symptoms, and do a complete neurological exam, spinal fluid tap, and collect a complete history medically and about maybe the last month or so, trying to keep track of what they ate, where they were, what they were doing, just trying to narrow down how to help them best. Give the patient steroids to avoid inflammation. Some cases they have given them antiparasitic drugs to help, kill the parasites faster. But if they're going to do that, you have to administer the steroid to avoid the inflammation that comes from all of them dying. All you really can do is just try to make them comfortable and manage their symptoms and just monitor the patient well. So some epidemiology is, that it's been found in Southeast Asia and the Pacific. 25% of the population in the Caribbean have infected, and there's been spreading reporting cases here, obviously, that we all heard about, New Orleans and Egypt, and, people by traveling, whether it's infected stowaway rats on boats and things like that. I'm not really surprised to hear New Orleans on the list, because if you think about it, these are things during freshwater exposure, snails, freshwater prawns, things like that. So for New Orleans, there's a lot of wetlands, fresh water, and a lot of the people will fish and catch things and then just eat them. So I can understand how that can be a danger. And then, is this preventable? Yes, this is preventable. So you need to wash your produce. I know, there's things that are grown hydroponically and things, that you don't think, oh, it's food safe. Always wash it, just to be sure. You never know. You never know. And especially when you're out in the yard and you're gardening, or someone who's out in their gardening, get them to possibly wear gloves and to always wash their hands before coming back in the house and touching other things that other people can touch. You never know, the smallest thing could actually end up giving you exposure. And to avoid eating raw or undercooked snails, freshwater prawns, crabs, or frogs. Things that might be able to contract this parasite. I know it's hard to believe, but you just have to be careful nowadays. I know there was a guy at the college who actually got this disease, and he was very sick and in the hospital for about 2 months. He survived and he's doing better now, but you never know, and it's just really hard to say. Just to be careful is the best advice. And that was my presentation. Thank you very much. I hope you guys liked it and learned something.